All right. Thank you for that prompt.
No problem.
Every time. So welcome everybody to the COVID Champion session, 6th of May special on resuming on helping Torbay reopen safely. We know that some of you wanted to hear about this, so we're joined by Jason, who's going to talk about that a bit later. Just to outline the session now, I'm going to hand over to Kirsty.
Thank you very much. Okay, the outline of the session today is as we normally do. We're going to have their welcome and introductions, which we've done. Update on the COVID-19 in Torbay, and then we're going to be reporting on safely opening Torbay for all of us. Also, any questions that anyone's got, and then what we like is our little quiz. See how we can do with these questions this week, and then we're looking at the volunteering opportunities that are coming up, hopefully to involve everyone. Next slide, please. Okay, etiquette for this, please. Make sure you're on mute unless you are speaking. It's amazing how much background noise can be heard. If you want to speak, you can raise your hand, and we're going to tell you about that in a minute. If your signal is poor, it does tend to help if you disable your video. That sometimes helps. If you can post your questions in the chat, and we'll try and answer them. This is an open forum, so please be friendly and kind to one another. Obviously, we cannot answer any political questions or answer anything personal. If there's anything that you want to speak to us about but don't want to speak to us on here, then email us at champions@torbay.gov.uk. Next slide, please. Okay, if you want to write into the chat, there's a box. Just click onto the chat and it will come up and we can have a look at it. You can also raise your hand by clicking on to your participants, and it will come up on there. And just make sure that you mute and unmute yourself when you need to. Next slide. Okay, what are we asking? Okay, this is a partnership between us, NHS and yourselves. This is for you to give information to your friends and family, colleagues, people that you feel need to know this information, and obviously you're getting the right information to pass on to them. Hopefully they will pass it on to their neighbours. Obviously it is important that the information is correct that you're giving, so this is to make sure we're giving the credible information to share with everyone. Next slide, please. You were getting ahead of yourself then, Sarah. Stickers, they are on order. We have been looking at that, and hopefully we should be able to let you know when they're in, and there will be your certificates. We can sort that out, and hopefully the plan is to email them out to you. And we've got another clue for our top secret: Baden-Powell's movement for girls. Next slide, please. Okay, I'll leave you to do the data, Sarah, if you don't mind.
Superb. Thanks very much. Great. Okay, so here's your usual Torbay COVID data latest. For those of you that don't know, this meeting happens after the fortnightly or monthly local outbreak engagement board. So the good and the great of Torbay heard this information about 15 minutes ago, which means that we can tell you, but it's the latest up-to-date data that we've got. By latest up to date, it can still be a few days out, but that's because it takes time to count and validate and make sure that it's secure data. We only want to tell you proper data that we know is real, not speculate and create wonky models, which is what you might hear sometimes in the media. Not all information is the same. COVID cases in Torbay are continuing to decline, which is just the best news ever. So in January, the number of cases overall in the Bay was 1,215. In April, it was 60. So for cases for April, we're about at 5% of the case level for January, which is awesome news. There were an average of 2 cases per day during April for Torbay residents, and the current rates in Torbay are again the lowest since early September. I know I said this last time, but we don't think the numbers are going to get much lower, but I did say that last time, and then they got lower again. So this is fantastic. I don't know what we're doing here, but we're not only one of the lowest local authorities in the southwest is one of the lowest regions in the UK. So it bodes very well for us. so far. The number of cases aged 60 and over were at 3% of the case level for January 2021. And the current rates for Torbay residents aged 60 and over are the lowest again since early September, with just 9 cases in those aged 60 and over in April, compared to 305 in January. Pretty good, I'd say. In terms of COVID hospitalisations and new admissions to Torbay and South Devon NHS Trust, again, the numbers are at their lowest level since September. In April, there was 1 new admission in the whole of April, compared to 202 in January. So again, if that's the number of people who have been in the any of the departments, but including the respiratory wards and so on and so forth, which is again just fantastic news, important steps. In terms of vaccinations, the latest data up to the 25th of April. So I appreciate this. There's a bit of a lag in the data again here, so sorry folks. It's all good news though. The number of Torbay residents vaccinated with at least 1 dose is 96% or more for those aged 50 and over. 37% of Torbay residents aged 50 and over have had both doses. 28% of Torbay residents under 50 have received their first dose. This equates to 44% of the 18 to 49-year-old population. I'm delighted to say on a personal note, I've been invited to get my vaccination now as well, and I can't wait. I'm really excited about it. Hopefully it means I can get out and about soon. So yeah, if you're inclined, if you're not a vaccine hesitator, I would encourage you to get to it as soon as you're ready. So that's it. Yeah, 28% of under 50s in Torbay have had a first dose, 96% of 50s and over have had a first dose in Torbay. So again, we're absolutely smashing that in terms of our populations. Good job. In terms of deaths, and this has been one of the saddest elements of the whole COVID experience for all of us, there have been 4 COVID-related deaths registered for Torbay residents in the last 7 weeks. Tragically, the majority of these deaths relate to care home residents. The rise in deaths lags significantly behind rises in cases, but it does follow that if we see fewer cases, we will see fewer deaths. So my sincere hope, and I'm sure I share it with each and every one of you, is that we have seen the worst of this off, and that we won't be seeing the rates of deaths as we've seen in previous months in Torbay and across the UK and indeed worldwide. Any questions on the data from anybody, please? Any comments or queries or anything you'd like to share or say at all actually on the data?
It's Nigel, do we have any, I might have misheard, but do we have any data for Torbay Hospital or the actual people in? Because some of the information I've read, we haven't had anyone in Torbay Hospital with the virus for at least 3 to 4 weeks.
There was 1 in April, Nigel.
Yeah, I heard that.
And I think that continues. Do you mean, does that continue? Yeah, I believe that continues. Certainly the last time they reported to us, that was still the same case, which was, what day are we? Which was earlier this week, I think.
Okay, good news. Does that answer your question okay, Nigel?
Of course.
Superb. All right. Any other questions for anyone else, please? All right. Well, I'll take that as good news. Just having a quick look around. Welcome everybody else who's joined us. Thank you for coming along today. Nice to see you. Right. Well, in which case, I'm going to crack on. If there's no further questions on the data, I think that means that, Jason, over to you.
Well, good afternoon, everyone, and for those that have joined us. My name's Jason Garside. As it says on your screen, I'm the Managing Director and one of the owners, TLH Leisure Resorts, which is a 7.5 acre complex in Torquay. We employ around 350 people, so we're a fairly substantial employer in the Bay. And is this where I ask for next slide, please? Okay, well, this is jump to slide from where I have on my other screen, but that's fine. So obviously, like everyone else, in March of last year, COVID arrived on our doorsteps. So next slide. And that's the big COVID wave arriving. And it was very much obviously unprecedented, an external event with little or no scope for us to control it. What we saw in the early days, and thankfully this has subsided somewhat, is constantly changing guidance as governments, local authorities, and indeed everybody were finding their way. And there was no prior equivalent business continuity plan that you could pull out of a drawer and run to. So everything was new, and we very much spent the early days finding our way. Next slide, please. Okay, here we go. So how we responded in the early months. So we put together, COVID early March, we had a sense that we were going to be asked to close as a business, and we put together a management task force to look at all impacts COVID, whether that was on us as a business, our employees, and the wider effects. And we started carrying out risk assessments. Now, as a large establishment, we're well versed in risk assessments, and also we have the unfortunate privilege of the last 20 years of having to control things like norovirus. So if that's not something you're familiar with, this is a virus that's spread easily, causes sickness and diarrhea, and affects large establishments like ourselves, and indeed cruise ships, as you may be familiar with. So we already had a good handle on protocols for infection control. So that gave us a bit of a head start. And we also wanted to start planning recovery and indeed survival at that point. So we started stress testing our business to ensure that we could survive, and also knew that we needed more knowledge. So it started to expand our network. Next slide, please. So again, how we responded, we knew, employing as many as we do, that engaging with our colleagues was critical to make sure that they were well informed. We had to understand the impacts that this was slightly prior to furlough being announced. This was in the first week. Understand how flexible our workforce was, and to make sure that we had a plan for rolling engagement with our colleagues. Given that we knew at that point that we were going to be closed for an unknown period of time, we wanted to make sure that our people, as they were sent home, knew what their futures held and our futures as we saw it. And we also formed, because we had to retain a skeleton crew of staff, 7.5 acre complex. So we retained throughout COVID our senior team, as we call them. And they started to form representative forums for their employees, so the people that report to them, and we established a clear voice of communication. Next slide, please. And we also, as a business, because there are 4 hotels that make up our site, started to introduce a one team, one approach, and alongside that develop COVID policies for us as a management team to promote transparency, accessibility of guidance, and to make sure that our customers had a corporate viewpoint of how we were responding to COVID. During this point, we were reviewing and revising our colleagues' contracts to make sure that we could have this one team approach. And we started to develop and promote an overarching keeping colleagues safe branding. As much as it ensured that we focused on how we do keep our people safe, and there were periods, as you're aware, that we were able to open, so the summer of last year. And we wanted to make sure that all of our people processes were updated and relevant to the times we are in. Next slide, please. We also, from a guest point of view, had to adapt our marketing approach, and we needed to make sure for the periods that we were open during the summer that the changes that we have guest profile, because people weren't going abroad and all of a sudden we had a lot of new guests, first time visitors. We had to make sure that we were managing their expectations of a changed product with social distancing, and making sure that they had clear understanding of how we were keeping them safe. And during it, we also sought feedback on our COVID secure compliance from not only our customers, but also our workforce, to make sure that what we were saying was being implemented. And we carried out a staff survey during the height of the pandemic to make sure we understood how our employees felt. Next slide, please. So we've learned a lot over the last year. The power of regular, planful and integrated communication, how important that is to for our business. That our teams aren't working in silos, so we have this one team, one approach. And we keep testing the status quo, because again, this isn't just as a result of COVID, but it's making sure that we are continuously learning and improving how we look after our people and how we run our business. Integrated risk analysis of the business continuity has become part of our core planning cycle, which just means that we can weather storms and we have good forward vision of how we might do that in the future as well. We need to make sure we're nurturing our guests and colleagues' perspectives, and that again, that's through empirical data. So that is staff surveys, not just what we think, it's what our staff say, what our customers say, and making sure we're, again, throughout COVID, I think the point has been made about misinformation, making sure the information that we're digesting is accurate, because that forms part of our decision making. And the requirement for strong leadership capability across all of our management layers, so that's development of them as individuals and us. And where we've grown, again, considerably over the last year, more so than other years, although we've always tried to be engaged, is knowledge sharing and networking. And part of the reason I'm here today is in that spirit of engaging with local communities in all sectors. And we know that we need to be agile and flexible, and be able to adapt and innovate quickly. Next slide, please.
You ended it on that agility and flexibility, because I don't think you've seen the next ones.
Okay.
Well met, Jason.
yeah. So beyond that, because this was put together, and I'll touch upon it briefly, part of our engagement with the local authorities, health service, etc. We're participating in a public health study, and we're looking to pilot a scheme for well-being for people coming back into the workplace, and obviously we are put ourselves forward as COVID champions. And we understand that keeping our staff and customers safe, it's always been our first priority, and the importance of working with our community and local leaders, and that's brought unexpected benefits in terms of knowledge, but also relationships and ultimately business opportunities. So it's been fantastic. Shall I go straight? I'll go straight into the bid company presentation, of which, for those of you who have just joined, I also sit on the board. And the bid company, just to give you a bit of a flavour of what they are, if you're unfamiliar, it's made up of levy payers. It represents hospitality. We're one of the largest levy payers into the bid. And fundamentally, it's a destination marketing vehicle made up of industry, people with vested interest in industry, headed up by Carolyn Custerson, some of you may know. Predominantly we're here to make sure that people choose Torbay, should I say, sorry, Torbay over other destinations, and that takes a real concerted effort. So this is the website on screen, and this is the big company. Something I want to touch upon before I move on to the next slide is, as I said, the big company predominantly was set up as a marketing vehicle representing hospitality. But over the last year, I have seen the big company turn its efforts to supporting local hospitality businesses who aren't in the position that we are as a large entity. We've got, we're well financed, we have lots of resources, so we can garner information fairly quickly that has helped us navigate COVID. But there's lots of small operators of bed and breakfasts, smaller hotels, etc. out there who really, without the big company disseminating what was a confusing picture initially from government and making sense of it all, and then making sure that that information was delivered to those that needed it, has really been a testament to Carolyn's work, to be fair, but the big company and the entity as a whole. So what it's ensured is people operating in the industry know how to do it safely, know how to make sure that their customers are informed that it's being done safely, and really to just instill confidence in everybody, including themselves. Next slide, please.
This is the last slide, by the way.
Okay. There was a much bigger slideshow that was delivered on my doorstep this morning, so it would have been the second time I viewed it. But over 350 local tourist businesses have signed up to this national scheme, which was introduced by Visit England. This is the We're Good to Go. And this logo gives customers confidence that each business has adopted the necessary COVID guidelines. And the guidance is reviewed after each lockdown, and any changes communicated to businesses. And if you don't know, I'm sure you do, that the 17th of May is the next planned major step in government's roadmap out of COVID, and all accommodation is planning to be open, save any curveballs from COVID. We hope there are none. The industry is so important to the Bay, and the Bay is so skewed towards hospitality that not opening up would cause hardship for many residents of the Bay who are employed in the sector. And the English Riviera, a big company, has meetings with DCMS, which is the government department responsible for managing the guidelines, once every 2 weeks. And they have regular calls with our MPs. They also, the big company, lobbies for changes within the industry that we'd like to see. And there's been two requests, the request for 2 metre social distancing rule to be reduced, as this has serious restrictions on capacity and a serious restriction on business revenues, which again, from a local point of view, employs, a substantial amount of people. And again, without hospitality, our Bay wouldn't look as thriving as it does. And we continue to work closely with public health and licensing departments across Torbay Council to make sure that we are using the latest data, the latest learning from government, from scientists, to ensure that what we are doing as an industry is done so in a safe manner, because we're under no illusions. We need healthy employees, we need healthy customers for a thriving industry. So getting that right is central to everything we do. And that's the last of that slide.
That is the last of that slide.
Definitely the abridged version. Okay. And I'm here for any questions that you might have.
Thank you so much, Jason. That was really, really interesting. It's really different to hear sort of your journey and how it's been in the leisure industry, and obviously the local impact for you guys. Champions, over to you. What questions would you like to ask Jason, or what comments would you like to make about reopening or the impact on business? Anything at all?
It's Nigel. Yes, Jason, I actually know you from a few years ago. Just wondering, as obviously you are perhaps one of the biggest, maybe not the biggest in the area, but certainly one of the biggest that employ staff. Have you managed, obviously everyone's hoping at the end of this month hotels will be opened, but have you managed to keep all of your staff?
Yeah, so I'll answer that directly. So we, during COVID, prior to COVID, we were looking at a small reduction in our property department for reasons not related to COVID. So we employ, I'm going to say 350, and it varies in peak times, Nigel. So it's sometimes up at 400 during the height of the summer, but predominantly it's around the 350 mark. We lost 30 members of staff all told across the board. Everybody else we retained. And as I say, part of that decision was made, was in the throes prior to COVID. And it was really about how we managed our property spend each year. We spend £1 million a year on investing in our property. And it was, so that was already happening, and that was probably equated to 10 people. So unfortunately, and it was the tragedy of all of this, is we made redundant 20 people out of the entire workforce. Now, prior to furlough being announced, and I think the news broke on the Monday, I forget the week, it was a March week last year, the news broke on the Monday that it was likely we'd be closing our doors on the Friday. And at that point, right up until the Thursday, they hadn't made any announcements about furlough. And we took a decision as a business to put everybody on holiday for the week afterwards, to allow us a moment of reflection and to see opportunity to see how we might survive and retain everyone. Now, the great news is that we lost less than 10% of our workforce, and every one of those is something that plays on our minds as owners of the business, because it's not what we do this for. But they were essential towards our survival at a point when we didn't know it was coming. And we celebrated on the last Friday with our teams, because we had all 350 of them in. This was the week of COVID breaking, by the way, I should add that. And they were all separated. And on the Friday, they all went home on the Friday morning. And on the Friday, I think it was early evening, it was on the news that Boris was there announcing furlough. And it's rare I cry in business, and I didn't cry too much. But it genuinely brought tears to my eyes, because I knew at that point we weren't going to have to lay off hundreds. And it was the thing we feared most, because we would only survive so long without that support before our cash was drained. So less than 10% is the answer. 30, I think it was 30 exactly. And every one of those, is a tragedy, because these were good people.
Absolutely.
Yeah.
Absolutely. Hard decisions and made in all businesses, aren't they? Thank you. Any other, what else would you guys like to ask? Any other questions or comments? Have I got the right champions group? You lot are usually pretty verbal, but
It's
okay.
Nigel, I can ask another question if
Please
you like.
Oh, Nigel, come on, help us out, mate. We rely on you, you know that.
Listen, I'm absolutely pleased. This is all new for everybody. Everybody's not the government over furlough. I'm fortunately not in that kind of industry. However, we are a volunteer group supporting local worthy causes, so we're sort of not taken out of that. We're taken out of that group. However, certainly for furlough, for majority of companies, has been their lifeline, no matter how much everyone else seems to knock the furlough system. It certainly seems to work for a lot of people.
You're entirely right, Nigel. It has saved, I would to say, millions of jobs across the country. I'll be aware that this is in the public domain. We went into this cash rich in the bank. We had a fairly healthy bank balance, excess of a couple of million. Over the last year, we have drained all of that because furlough made up 80% of salaries, but we were, we were retaining a core of staff, which numbered about 25 throughout the closed periods. But obviously on top of that, we are contributing to pensions, national insurance, and processing that payroll. We have drained all of that over the last year. We were in a great position. That wasn't a plea for poverty. But yeah, you are entirely right. Without furlough, the industry would have collapsed. So yeah, I want to tell you that I expected it on the Wednesday because it was coming out in Europe. It was already happening. So, and I couldn't see any. The government can't handle DWP as it is without adding millions onto that. So it would have caved in. So yeah, I'm too, can be a critic of government. This isn't a political, but furlough saved our industry and many others. And yeah, we agree, Nigel.
Well, that's lovely. Yeah. Okay. Thank you. Go on, Nigel. Anything else you wanted to add? Because I know that it's sort of partly your industry as well, isn't it?
Yeah. The other, as Jason said, the other answer to all that, if they hadn't have done furlough, it would have been a total different story.
Yeah. Yeah.
For sure. Do you know, I want to, this is COVID champions. I've got to, just because it's for the public record, what I've seen over the last year in respect of our partnerships with the NHS, we had recovering COVID patients with us at one of our hotels, which is why I'm on second vaccine already. It's not an age thing. It's
to be clear, that's on the record now as well. Thanks, Jason. Yeah.
Don't believe he's older and he says
No, I know. I think he's pulling our leg.
We have seen exceptional things done by our workforce, whether that's volunteering for the NHS. That's subsided over time because I think the need has reduced dramatically. But I have seen people who work for us out delivering prescriptions, some of our head chefs are still working in Exeter at the hospital. They were at the vaccine centre. And it's testament to the good nature of people, which I think is more prevalent than the opposite. And for me, it's quite humbling to see, people doing it not for financial gain, but for wanting to help, support, give back. And I've seen that across everybody. Everybody I've spoken to from the get-go within NHS, within local authorities, have been nothing less than exceptional. And it's been in some ways the toughest years. In some ways, so the best. I've seen the best of people come out. So yeah, it's what it is. Yeah.
That's quite incredible to hear, Jason, because I would absolutely echo that as well. I think we've seen the worst of times, but it's brought out the best in us, all of us. And Champions is absolutely about celebrating that. You could be anyone living in Torbay. In fact, for all I know, half these people might be in Leicestershire or Bangor, for all I know. Mm-hmm. But I'm sat at home. I haven't seen anyone for over a year. Who knows what's really going on out there? But everyone's here out of the goodness of their heart to give the right information.
Going on out there predominantly is my experience.
I do keep opening the window, but Jackie, you've got a question for us. Hi, Jackie. Welcome.
Hi, Sarah. Hello. Jason, thanks for your talk. Just wondering, how are you finding it getting the staff to come back? I have heard that there have been some issues with staff obviously having found jobs elsewhere and with some staff worried and concerned. You touched on well-being yourself in your talk. So I just wondered if you'd had any challenges yourself as a business.
Yeah, so what we've found is, Brexit also will have had an impact, but we're not doing Brexit on this call. We definitely foresaw an issue when maybe not first lockdown, but as second lockdown came and you could see a third lockdown, and you could start extrapolating, thinking, okay, if this is going to be a prolonged issue, and I think it's human nature when you have moments of opportunity for reflection, whether that's being at home, being around your children, spending more time at home. It gives you an opportunity to think, reassess your life, and you know, do you move on? Do you do less? So as a business, we definitely foresaw that maybe September time, when you could see that there was potentially another lockdown coming. And I forget what the dates of when they happened, by the way. It's been a crazy year. And we started to discuss as a business, okay, we're going to, when we bring people back from furlough, we knew furlough was in place, so that could sustain as such. We knew that it would have an impact when we opened our doors, and people will have moved on. Some have moved back to Europe. So what we're finding as a business is fortunately, our core management team is fairly stable. So we've had to recruit some frontline staff, so waiters, housekeepers, etc. And we're not doing terribly, to be fair, in recruitment. We've had some fantastic candidates come across. I think there's a sense of the industry that people are mindful, there's still people out there who would contemplate another lockdown. I've got to say, I couldn't see government doing it, even if they're not, it'd have to get pretty severe before I think they would change course. And I won't get into why I think that. But I think people are reticent to move jobs because of that fear. I know people were caught out moving jobs in between lockdowns and then finding out that they weren't entitled to furlough. So I think there's some caution there, movement within the industry if people are moving. I think some people have moved out of the industry and gone into things that they think is maybe less susceptible to things like COVID. Obviously, supermarkets, etc. The world is changing how people are shopping, so they're requiring more people. But I've got to say, when we're expecting a few more to fall out when we start calling them back in properly, which won't be until at least the week before the 17th, and then probably fully from June. Our forward business is very busy from June onwards for the remainder of the year. So I think at that point, when we call people back, we'll find out there's more that have moved on. We actually said to them at the beginning of this, when this was via a video communication, that we encouraged them to, if they could, find other paid work, whether that was working for NHS, whether that was working for supermarkets. And that was two-pronged. That was one, to support the effort, why, if you don't want, and mental health, you sit at home for a year and you can become a bit doolally after a while. I'm sure that's not politically correct, but so we said to them, if you find work that you can supplement, we're paying lots of them 80%, so they're not receiving 100% of their pay. So we said, if you have opportunity to make that up, do so with our blessing, with the proviso that when we ask you back, you come back, and if you don't at that point, you tell us you've moved on. So I don't foresee it being a big problem in the Bay. We're such a big employer as an industry within the Bay, and work, unfortunately, within the Bay outside of the NHS sector and outside of potentially the supermarkets is limited. So I think, unlike other areas in the country who will definitely struggle, I think we'll have less of an issue. But as I say, the pleasing news for us is we opened our doors for our gymnasium and swimming pool and outside dining areas earlier in the month. And so we've got quite a few back on board already, and lots back on board taking. So I don't have any concerns per se, but we have an expectation that we're going to have to fill some roles. But we're, from a geography point of view, quite lucky that other opportunities are fairly limited, whether that's a good thing or not.
That's a whole other session, but interesting.
Yeah.
Sorry, Nigel, was that you again? I'm sorry.
No, it wasn't, but I can find another quick question.
Come on, then.
Carol's got her hand up.
Oh, Carol, sorry, forgive me. I'll go to Carol and then Nigel. So back to you, mate. Okay, so Carol first, if that's all right, please.
Jason, thank you for your talk. I just wanted to say, as an ex-hotelier, I watched last year with complete trepidation. It must have been an emotional and logistics nightmare. And I think the way in which you've handled it has been thoroughly inspiring. And thank you for sharing that with us. And I wish you every success for your coming season. You certainly deserve it. You've handled it so very well. My question is, do you intend to use vaccine passports, and will you be making use of the available testing kits?
So vaccine passports is a fairly emotive question because of well, one, there's not clear guidance as to how they may look. I was asked this question by Channel 4 News the other month, and my response is the same, which is, until I understand the detail of what that would be, the last thing I want to do as a person, forget as a business owner, is to discriminate against anybody. And if I would need to understand how a passport scheme would work within the UK. I've got to say, if I'm getting on the plane, and this is my personal view, by the by, if I'm getting on the plane, I probably would want to feel like everybody on the plane, because of that close proximity, that recirculated air, it has some sort of passport personally. The likelihood is I just won't travel abroad for the remainder of the calendar year. I think what I wouldn't want to be doing is turning away any ethnic group or other group who, for whatever reason, and I was reading an article today on why the take-up of black people is less in the UK, and it's made up of lots of history. Not, the last thing I want to do is be turning people away at the door because they have deep held views about vaccinations and so from my point of view, I see the benefits, by the way. I see that if everybody who passed through our door has 2 jabs and they're fully vaccinated, how that could be a great marketing tool for us. But in the same hand, what happens when, if you, for whatever reason, you haven't had a vaccine or can't have a vaccine, how do we treat you? So that's my concern there. Sorry, the second part was testing and tracks. Testing. Testing, I hope to be looking at with the wellbeing pilot that we're hoping to engage with, and that return to work. We're not currently looking at purchasing testing kits ourselves. However, discussions with local bodies may result in that for our employees, if that's something, and that's something that we would happily participate in. Ourselves, we have created clear guidance in respect of what we do with anybody with symptoms, which includes full pay, because and this was from second opening, or sort of opening after first lockdown, that we didn't want people to turn up to work who felt like they had symptoms because they didn't want to be paid, or that for some reason. We have company sick pay, but there are waiting days for some. So we wanted to make sure that anybody who felt like they had symptoms went home and there was no reason for them to come into work. So we took a fairly lenient view in respect of how we would treat them during COVID from a company sick pay point of view. And yeah, I mean, we own temperature guns. However, through discussions with NHS partners, etc., the reliability of those was questioned. So we didn't want to. Again, we discussed in the early days whether we took the temperatures of our customers, and I think something that stuck with me which was one of our local authority partners said to me, you could be sending home menopausal women who turn up at your doors because they have an elevated temperature. So we quickly learned that the temperature thing wasn't the right way to go. And as I say, when we look at the return of our staff and the well-being of our staff, that I would imagine will form part of that sort of discussion, because it's about giving them some confidence in returning to work as well. So that daily flow testing, etc. We have lots of boxes here because we were using them daily when we were looking after recovering patients. So the answer is the jury's out on where we go with that until further discussions, and that's the benefit of the last year has been these relationships with local authorities, which we've always had from a food standards point of view or a norovirus point of view, but actually it's not making knee-jerk reactions and listening to their expert guidance in how we best manage that sort of thing is how we're approaching that. Does that answer your question? It was a bit of a ramble, I apologise.
Yeah, mildly, but really interesting actually. I thought it was pretty bang on. Carol, I'm interested in your question as well, which I thought was excellent. Do you have your opinion about passports, may I ask? About vaccine passports in particular?
Actually, I'm totally with Jason. I think they're a very good idea in certain circumstances, and if I too were flying, would feel the same way. But we do have to be careful, especially when you're in a goodwill business. You can't be turning people away. It's you have to look at ways of making sure your staff and customers are safe in the least obtrusive manner. Do I mean intrusive? Whichever.
I think I know what you meant. Yeah, yeah.
Thank you.
And Carol, just alongside the employee point of view, from our customer point of view, we rolled out a COVID guarantee early in the year, which again, to discourage people arriving because they've paid their money.
Yeah.
We had a no quibble, refund policy, and that's going to be with us for as long as it needs to be. To again discourage people from feeling they have to come, because they definitely will if they've paid their money. People, a few, the minority I will say, would travel with one limb hanging off if they
Wow, it's just that or lose your, a few £100 you've paid for your holiday you've been scrimping for.
So
it's a really good scheme for industry and people. It helps everybody, doesn't it?
So making
really good
sure
schemes.
the people knew, no quibble guarantee. You can't come. You can either postpone your holiday and come when you're better. So we introduced that fairly quickly again to that soft approach, Carol.
Okay.
We're not the police. We are in the hospitality industry, and we need people to feel that we do it in the nicest way possible to discourage people passing through our doors who may infect others, for sure. And that's true of COVID, and was always true of norovirus as well. We had a similar sort of approach, so that people never turned up, or rarely turned up, having exhibited symptoms in the days prior to arrival.
Good. How interesting. Okay, now we're running down the clock a little bit, so we're going to take the final question from Nigel, and then we're going to crack on with a quiz, if that's okay. Unless anyone's got any other questions, as you know, I'm happy to suspend all activities in pursuit of a good conversation. So happy to go with what you want. Nigel, let's hear from you, and then we'll see where we're at the end of that.
Quick question and an observation. The observations, I actually agree with passports into the extent of, I think, if you're going abroad, I cannot see any argument for not having a form of passport, for the simple reason, in certain countries you go abroad, you've got to have certain jabs as you can't go. As in the UK, maybe a slightly different matter. However, there is already, I wouldn't define it as a passport, but certainly an ID card, because every time you've had both vaccines, you actually get a stamped card to be proved that you've actually had both vaccines. So that may be one thing to look at. But yes, the other issue is you cannot discriminate if somebody at the moment don't want it. We can all argue that, but certainly there are a category of people who can't have the vaccine. So obviously that is the
Absolutely.
issue. We are guided, because we hire coaches in for our few day trips that we do, and we're guided by the that particular coach company, and they're exactly the same. Then they can't demand passports or any ID. As simple as that. We just do the normal hand cleaning, and if they want to do temperature checks, that's fine. But that's just the way it is. The question was nice and easy. Aztec Bistro, do we know when it's actually, subject to the 17th of this month, actually going to be open? And when it is open for inside, when will they put a full menu on? Because last year when they reopened, it was only a partial
menu. So I can answer all of those questions, Nigel. So the bistro terrace is currently open, so they are serving food outside. All of the tables, as you would imagine, are socially distanced, and outside dining is permitted. From the 17th, Nigel, it's envisaged that we will be able to dine inside, and at that point, and in fact, for the entire year, we've made an assumption, by the way. We hope that it's different to our assumption that social distancing is going to be in place at 2 meters, I've got to say. Any relaxation on that helps us as a business, but from a planning perspective, we have to assume the worst, plan for the worst and hope for the best, as they say. The menu reduction, I do want to touch on that, was part of that risk assessment on how many people you can have in a kitchen, how many people, predominantly that was the driver for that. So we offered a reduced menu, and we still are. And it's envisaged, Nigel, to answer your question directly, that as of the 21st, is when we will be able to offer the full menu. So longer than I'd like. I have lunch here every day. I'm bored now of the restricted menu. But again, driven by how many people we want in kitchens. Yes, they've got PPE, etc. But at the moment, we have to assume social distancing remains with us until the 21st. And we are hopeful that after that, there's a relaxation. And that will be in time for our busiest time. And Nigel, I can't wait for it either.
Excellent. All right, thank you. Are there any other comments or questions? You're very welcome. There's only a few of us left. I know some of our team have had to leg it to an outbreak meeting, I think. But any questions from anybody else? All right, we've got 4 minutes. We're going to do the quiz. That's how it is. It's my last week as well. So I'm going to rack out the quiz. Jason, join in if you can. It's true or false. Nigel, I think you've had the question, so you think you know what's coming up, hopefully. Question 1, launch it, please. Hit it, Eileen.
Yep, done.
Number 1, we can eat outdoors. We can eat out indoors this weekend. Is it true or is it false? We can eat out indoors from this weekend. Is that true or is it false? Question 2, gatherings of over 30 people are allowed from 17th of May. Is it true or is it false? Hit your buttons. Question 3, we will all be able to enjoy cinemas and children's indoor play areas from the 17th of May. Is it true or is it false? Frankly, if half of you are in children's indoor play areas, I'm going to be a bit worried. You're not allowed. But maybe you'd like to take your own kids or your grandchildren or your nephews, nieces, friends, neighbours. So question 3, we will all be able to enjoy cinemas and children's indoor play areas from 17th of May. True or false? And the last question, social distancing, as in remaining 2 meters apart, still required of everyone in the UK after the 17th of May. Is it true or is it false? Okay, the scores are on the doors. Helen's going to help us out with the answers. So question 1, how did we do, Helen? We can all eat out indoors from this weekend. 100% of people said false. What do you say, Helen?
You're exactly right. It's false. We're too early at the moment, although we really want to. We've just got a bit more time. So yeah, so after the 17th, all okay, but not currently this weekend.
Brilliant.
It would be devastating if I got any of these ones.
The good news is you can't say who's, you can't see who's voted, and it's all good. Okay, number 2, gatherings of over 30 people are allowed from 17th of May. 25% said true, 75% said false. Helen says.
Okay, the 75% are correct, so it's false. So yeah, at the moment it's up to 30 people. So, okay. Oh, hang on, I've got the wrong. Sorry, can you just repeat the question? Sorry, my eyesight's not very good. So.
No, sorry, gatherings of over 30 people are allowed.
Yeah, so yeah, that's false. So it's up to 30 people currently, and that's there are sort of other areas like big sporting events, big pop concerts that will obviously be allowed to have more, and there are certain levels for that. But yeah, at the moment it would only be up to 30 people from the new changes.
Okay. So as with all these rules, we can see that generally there's an exception. So if you were the person that said true, we could see why you would have said true. If you're going to, I don't know, Ascot or I don't know, a festival, then you might be right. But generally speaking, more than 30, not really on yet. Nicely divided here. Question 3, we will be able to enjoy cinemas and children's indoor play areas from 17th of May. Half said true, half said false.
Okay, that's true. So yeah, that's all okay from 17th, so that's fine.
And the last question, social distancing, as in remaining 2 metres apart, is still required of everyone in the UK after the 17th of May. 100% of people said that was true.
Yeah, you're exactly right on that one. It's true. There is discussion going on. I think Jason touched on it earlier, just around so the government guidance around that. But currently, as we stand, social distancing is still required, but we're just waiting to see obviously what's happening on that at the moment.
Okay, excellent. Well done, champions. Thank you very much. So social distancing the Torbay way, we've been promoting that the idea of 2 metres is about a beach hut width. I really love this one from last year. I really like it when our organisation gets it right as well. And I thought that the Basil Fawlty social distancing the Torbay way was quite funny. First I saw about it, I was on Twitter and I saw John Cleese retweeting it and I was just thought, come on. The social distancing is also 1 Basil Fawlty length. Our key messages this week for you, the things that we really want you to take home and talk to your mates and pals about, is that businesses in Torbay are working extremely hard to overcome and adapt to COVID-19 and all the challenges it's presented them. Businesses, as well as communities and councils, rely on excellent data, not hearsay. So spread the facts, not the fiction. None of us can deal with a sense of unreality. It's quite damaging. So let's just stick with what we really know. It will help us all get back to normal as soon as possible. And last one, we've kept this message. This is the 3rd time we've kept this message, but we really believe it, which is please keep being extra kind, extra patient, really respectful. No one has had it easy in the last year. And it's more important than ever that we remain together as a whole Torbay community. So please keep being kind. We know that you are. We love the hashtags Responsible Riviera. We like the hashtags Respect, Protect, Enjoy. It helps people like Jason and all of his staff, as well as all the other businesses in Torbay, when visitors who come here trust and believe us and go, you lot really got it together. You've got really great low rates. Not only are you all trusted businesses, you've got this COVID champions thing and you all seem to know each other and kind of like each other. We're coming back to Torbay. That's what we want lots more of. So let's keep that on the roll. In terms of champion jobs, the 4 things are: share your facts with your friends. We know you do. We know you do, and we're grateful to you all for doing that. Keep doing what you're doing. Share a post with your people. If you're on social media, tell them about the beach hut distance or the Basil Fawlty, or invite them to the children's play area, but after the 17th of May, whatever it is. You're very welcome to come and get your badges and certificates now. Jason, we really hope that you and your company sign up to be Torbay COVID champions, and we can support you with any stickers or promo. I know you've got your own thing going on as well, but anything that brings us all together is good. If you've got a loose end as well, lastly, and you fancy hanging out at one of the mobile testing sites and spreading the good word of facts, not fiction, give us a shout. We're always looking for extra bods to come on those days. But don't feel like you have to. I'm going to leave it there. We're slightly over time, and I just want to say huge thanks to our special guest, Jason. Thank you for joining us. Yeah, it's been really interesting. And thank you again, champions, for your questions. Really insightful, dead interesting. You guys are a marvel every time. So I'll just hand it back over to you if anyone wants to say thank you or goodbye. I'll leave you to it. But thanks everyone for coming today. It's been a pleasure.
Thank you, everyone. It was genuinely a pleasure to meet you all, for those I haven't met. Nigel, when you're next in, definitely have a coffee. Ask for me. Love to see you. And that's extended to any of you on this call.
You never have any money on you, Jason. I know you.
He really knows me well.
All right. We're going to come en masse.
Genuinely welcome. Lovely to be involved. And yeah, thank you for all your support, all the various bodies.
Thank you. Bye-bye.
Thank you.
Stay.
Bye.
Good luck this month, Jason. Thanks, everyone.
Cheers. Bye.
Cheers all. Bye-bye. Brilliant.